Hi, I'm Dr. Matthew Carpenter.
And I'm Dr. Melissa Russ.
We wanted to have some time to talk with you about the purpose of our practice and what it is that we do. You'll see if you visit the section of our website entitled What Do We Do, you'll see bulleted points, lots of them, of the different and unique therapies that we offer. We're very excited about those therapies. We're very excited to work with people like Blanche Gruby and Hal Huggins and the best people that exist these days at trying to help people with the types of health challenges that result from being exposed to metals. But we remember all the time that it's not the unique testing or the laser or the ozone generator or any of these things that is actually the purpose of our practice. The purpose of our practice is to serve you. The purpose of our practice is to try to give our loving patients back a component of their lives that they've lost. We don't market or tell people, you know what, we're going to get rid of that leg pain or we're going to get rid of that other thing. We focus and work in the mouth. But the reality is that the mouth and the body are one unit. So when we remove poisonous metals from the mouth, we decrease a person's exposure to those metals, and frequently we see improved immune function and we see improved well-being as a result of not having those toxins in their bodies. Dr. Russ and I really share a passion for this type of work. It was really more of a naturopathic concept that I got this from, because in the old naturopathic repositories and annals and all these things, you see that they came up with very sophisticated ways of documenting how people felt. And they learned therapy and modalities according to try to help their patients to improve. I think it's so critical, and Dr. Russ, I know, agree that we always try and make the center of our attention and our passion restoring life and joy and well-being to the patients we serve.
Some of the services that we offer that allow us to bring a patient into an awareness of what direction they need to be going in would be maybe compatibility testing, mercury testing to see what the levels are, any kind of metal testing to see what your levels are, food compatibility testing, and reactive food panels. These all give me a lot of information on which direction and how to help the patient in detoxing and in improving energy, sleep, and just hitting all of your health goals. We aim to really spark that awareness in every patient, not just the patient coming in to have their metals removed specifically, but in other surgeries to be able to condition a patient and get them ready for surgery, and then really help them gracefully recover.
It's been one of the most amazing things that I've observed by working with Dr. Russ is that unfortunately, we approach the care of human beings very superficially. And I can't tell you what a difference it makes in a person's surgical process to intake the right types of fats and oils for a week before the surgery, or to have the proper mineral support after to rebuild new bone. These are not things that were stressed in my education, and interestingly, I find them to be the most important factors in trying to usher a person back to health. So in the types of patients we serve, and let's admit it, I mean, the last place anybody wants to go is their dentist. And that's really what the point of our practice, Transcend Dental, is we want to transcend the perception and the mores that people have about dentistry, because we're doing it a lot differently in our office. We want to help people understand that there's a health-building relationship there, and we're very excited to try to help you with your health.